Angel Nurse. Today's video is the third part of medical and nursing terminologies. This video also covers terminologies in alphabet A. Let's go into the video. The first terminology is acetylcholinesterase. Acetylcholinesterase is an enzyme that breaks down acetylcholine. Acetylcholinesterase is an enzyme that breaks down the neurotransmitter acetylcholine at the synaptic cleft. Synaptic cleft is the space between two nerve cells. When acetylcholine is broken down at the synaptic cleft, the new nerve impulses can be transmitted across the synaptic gap. Second one is achiria. Achiria is a term which is used to refer congenital absence of one or both hands. Achiria is a term which is used to refer congenital absence of one or both hands. Next one is Akiropodi. Akiropodi is a term which is used to refer congenital absence of the hands and feet. Akiropodi is used to refer congenital absence of the hands and feet. Next one is Achilles tendon. Achilles tendon is one of the longest tendons in the body that attaches the calf muscles to the back of the heel bone, that is the calcaneus bone. Next one is achlorhydria. Achlorhydria is a term which is used to describe a lack or hyposecretion of hydrochloric acid in the stomach. So achlorhydria may be caused due to pernicious anemia or stomach cancer, or it may be due to Helicobacter pylori infections. The next one is Choleric Jaundice. Choleric Jaundice is a type of jaundice where there will be excessive unconjugated bilirubin in plasma without bile pigments in urine. So in Choleric Jaundice, there will be excessive unconjugated bilirubin in the plasma, but there will be no bile pigments in the urine. Unconjugated bilirubin is fat soluble. It is not water soluble. Since it is not soluble in water, the unconjugated bilirubin cannot be excreted in urine. That is why in Choleric Jaundice, there will be no bile pigments present in the urine. Next one is achilia. Achilia is a term which is used to refer absence of chyle in the small intestine. Chyle is a milky body fluid that contains fat droplets that will be drained from the small intestine into the lymphatic system during fat digestion. The next one is acidosis. Acidosis is a condition where there will be presence of excessive acids in the body. So in acidosis, there will be presence of excessive acid levels in the body. This may be due to accumulation of excessive acid in the body, or it may be due to depletion of alkaline reserves in the body. In acidosis, the pH level of blood will be lesser than 7.35. Normally, the pH level of blood is 7.35 to 7.45. The kidneys and the lungs are the organs which helps to maintain the normal acid and base levels in the body. If there is any problem to the kidneys and lungs, it may lead to acidosis or alkalosis. Next is alkalosis. Alkalosis is just opposite to acidosis. Alkalosis is the presence of excessive alkali or base in the body. So alkalosis is the presence of excessive alkali in the body. This may be due to accumulation of alkali in the body, or this may be due to depletion of acids in the body. So in alkalosis, the pH level of the blood will be more than 7.45. So if there is damage to the kidneys and lungs which maintains the normal pH of the body, it will lead to conditions called respiratory acidosis and respiratory alkalosis, metabolic alkalosis and metabolic acidosis. Next one is acid-base balance. Acid-base balance is a term which is used to refer the mechanism used by the body to maintain the normal pH levels of the fluids so that the body can function normally. Next one is acne. Acne is a term which is used to refer localized skin inflammation due to overactivity of oil glands. It is a localized skin inflammation due to overactivity of the oil glands which are present just beneath the skin. The oil glands produce oil continuously and the oil comes out of the skin through small openings in the skin. If the openings are blocked, then the oil will be accumulated in the oil glands and it will cause inflammation of the skin. It is otherwise called as pimples and this is more common in adolescents. Next one is acne ciliaris. Acne ciliaris is a type of acne where the acne is present on the eyelids. That is, papules or pustules may be present on the eyelids. Next one is acne generalis. This is another type of acne where there is presence of acne on face, chest and back. Acne generalis is the presence of acne on face, chest and back. Next one is acne Mendosa. This is another type of acne where acne will be caused by or it is exacerbated by using drugs like lithium, steroids or halogens. Next one is Acne Neonatum. It is a condition of newborn babies which is characterized by presence of pustules and papules on the forehead and cheeks of the newborn babies, which usually resolves in a few months. The next terminology is achoria. Achoria is a term which is used to explain congenital absence of pupil of the eye. Achoria is the congenital absence of pupil of the eye. Next one is acoustics. Acoustics is the science which is concerned with sounds. Acoustics is the science that deals with sounds. Next one is acoustic nerve. Acoustic nerve is the 8th cranial nerve. It is otherwise called as vestibulocochlear nerve. This nerve is concerned with hearing, balance and head position. I have already explained about vestibulocochlear nerve or acoustic nerve in previous video. If you want more details, you can use the link given in the description box. Next one is acousticophobia. Acoustics means sounds, phobia means fear. So acousticophobia is the term which is used to refer fear of sounds. Acousticophobia is the fear of sounds, including fear of hearing own voice. Next one is acquired. Acquired is a condition which is not inherited or congenital. It is a condition which develops after birth. So the conditions which occurs after birth are acquired immunodeficiency syndrome or AIDS, malaria, cancer, etc. Next one is AIDS. AIDS stands for acquired immunodeficiency syndrome. Acquired immunodeficiency syndrome is an infectious disease which is caused by human immunodeficiency virus. Next one is acrania. Acrania is a congenital abnormalities which is characterized by absence of a cranium. Cranium is a part of the skull which contains cranial bones that encloses the brain. Next one is acrocyanosis. Cyanosis is a term which is used to explain bluish discoloration of the skin due to inadequate circulation. So acrocyanosis is a term which is used to explain bluish discoloration of the extremities, that is the hands and feet. Acrocyanosis is a term which is used to explain bluish discoloration of the hands and feet. Acrodynia. Acrodynia is a term which is used to explain pain in the hands and feet. Acrodynia is the pain in the hands and feet. Next one is acromegaly. Acromegaly is a condition which is caused by the secretion of excessive growth hormones by the pituitary gland. Acromegaly is a condition which is caused by excessive secretion of growth hormone by the pituitary gland after the end of the adolescent period. When there is excessive secretion of growth hormone before the end of the adolescent period, it will result in a condition called gigantism. In gigantism, people may grow up to 7 to 8 feet height. But when there is excessive secretion of growth hormone after the adolescent period, it will result in acromegaly. In acromegaly, there will not be any increase in height of people, but it will lead to thickening of the skin, soft tissues and the bones of hands and feet. So these people, that is the people with acromegaly, will have to use larger rings, gloves or shoes. Dear viewers, thank you for watching the video. I hope that this video is useful for you. If you really like this video, like, comment and share the video with your friends. If you are new to our channel, kindly subscribe and don't forget to press the bell button to get notifications. Thank you. Have a nice day.